vaccinated. Now on the answer desk, we know all of you have a lot of questions. So has Connecticut reached its peak in the Delta surge? And if so, what does that mean for us once temperatures start dropping and we're spending more times indoors this fall and winter? Channel 3 Eyewitness News reporter Mike Savino asked some doctors. He is joining us live from Hartford Hospital. And Mike, do those doctors feel that we've turned a corner here?
Well, they are still watching the data to see if there's any lingering bump from Labor Day weekend. But generally speaking, they do feel like what we're doing here in Connecticut is working, as those numbers show. But also right now, the CDC is watching 2 new variants. So how worried should we be about those? For the 3rd time in the last week, the governor's daily COVID update shows a drop in hospitalizations, this time by 37 patients over the weekend. So are we reaching a peak in the Delta-driven surge?
I'm not telling people to let their guard down, but we should be very pleased.
At the same time, the CDC is taking notice of 2 new strains, the Lambda and Mu variants.
We always expected another Greek letter to come down the road.
Could the Lambda or the Mu variant become problems for Connecticut this fall?
It is not necessarily something to be concerned with just yet. It is just a variant of interest.
The CDC is still studying the new strains, including how infectious they are and if either is resistant to the vaccine. For now, doctors say our strategies are working. Besides vaccines, we also have better treatments for patients who end up in the hospital.
We've made a lot of progress to this point. We're in a very different place than we were a year ago.
Doctors say the vaccine remains the top priority. In Connecticut, only 1 in 4 patients hospitalized with COVID is vaccinated. Hartford HealthCare says even a majority of breakthrough cases are patients who come to the hospital for another reason but test positive for COVID.
They're not requiring significant amount of critical care or ICU care, and they do make good recovery.
So if the vaccine is seen as the most effective tool, will Governor Ned Lamont look to build off President Biden's vaccine mandate with more requirements of his own?
I understand that sometimes if you push too hard, people push back, sometimes irrationally, even harder.
Now, a Pfizer official told CBS News on Sunday that the company is close to seeking federal emergency approval to allow kids as young as 5 to take its vaccine. Experts here in Connecticut say that we have enough doses to meet the demand, even if that approval comes. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.
Mike, thank you. So we want to know, will you have your children vaccinated when shots are approved for kids ages 5 to 11? You can see there 61% of you are saying no right now, 39% yes. This is an unscientific poll, but it is a way to get a sense of where you all are standing right now. You can still weigh in at WFSB.com/vote now.